assessment of the التقديم الأستاذ الدكتورة فيما شاكر. نحن نتناول الجزء السادس من الاسسمنت. طبعا احنا مثل ما قلنا الشباب انه الاسسمنت مالت الهار مرتبط بالاثنين سيستمات الابدومن والثوراكس، وهاي موجوده انتوا اخذتوها بالكورس الاول وامتحنتوا بيها وجبت لكم كيس ستدي بيها، فاخذتوا كفايتها. فهنا بهذا الكورس احنا ناكد لكم على الاسسمنت مالت الهار، وياها ناكد لكم على الابدومن والثوراكس. هاي مطلوبه من عندكم، لازم تراجعوها من مالت الكورس الاول. شباب هذا الفيلم جبت لكم، هذا الفيلم حتى يذكركم. فهذا الفيلم شنو يضمن؟ يضمن assessment of abdomen, palpation, light palpation, deep palpation. يشوفون بيه، يشوفون بالبيت للليفر، يشوفون بالبيت للسبدين، بالبيت للكدني، بالبيت للبلادر.
Over a full one. Next, lightly palpate the abdomen, avoiding only the tender areas. Using your fingertips, palpate the right lower quadrant, and then move clockwise to all 4 quadrants. Now switch to deep palpation. Following the same palpation sequence you used for light palpation, push in 5 to 8 centimeters. Note the size, location, consistency, and mobility of the abdominal organs. You should detect no tenderness, enlargements, or masses. However, mild tenderness over the sigmoid colon is normal. If deep palpation proves difficult, such as in an obese patient, use bimanual palpation. To palpate the liver, slide your left hand under the patient along the 11th or 12th rib and push up. Place your right hand on the right upper quadrant and push your fingers down and under the right costal margin. Ask the patient to take a deep breath and feel for the firm liver to move down with inspiration. Now try to palpate the gallbladder using the regular technique you used for the liver. Normally, the gallbladder isn't palpable. If it's enlarged, you'll feel it below the liver. Try to palpate the spleen next. Reach over the patient, place your left hand behind his back at the 10th to 12th ribs and push up. Place your right hand just below the left costal margin. As you push your right hand in and up toward the axilla, have the patient take a deep breath. Normally, the spleen is not palpable. If a bladder problem is suspected, you'll need to assess the bladder. Place both hands in the midline 2.5 centimeters above the symphysis pubis. Palpate in an upward direction until you feel the edge of the bladder. A normal bladder may not be palpable. Now palpate the right kidney by placing your left hand under the patient's waist below the 12th rib and your right hand directly above it. Tell the patient to take a deep breath and bring your hands together as he does this. If the kidney's palpable, you should feel a small round mass slide between your fingers. Palpate aortic pulsations by placing your thumb and index finger left of the midline. Estimate the pulsation's width, which should be 2.5 to 4 centimeters. Now test the patient's abdominal superficial reflex. To do this, stroke the handle of the reflex hammer or the wooden end of a cotton-tipped applicator across his abdomen from the side to the midline. Normally, muscles on the stroked side contract and the umbilicus deviates toward the stroked area. Throughout the leg assessment, note the leg's active range of motion, muscle mass, and strength. To assess the vascular system, inspect the patient's legs. Observe their skin color and condition, hair distribution, and toenail integrity. Look for abnormalities, such as asymmetry, venous patterns, lesions, and edema. Then, using the back of your hands, check the temperature of the legs from the feet up. It should be warm and symmetrical. Now, flex the patient's knee and compress the calf muscle against the tibia. Release the pressure, and then dorsiflex the patient's foot. Neither action should cause pain. Next, palpate the peripheral pulses in the legs. To palpate the femoral pulse, find the artery halfway between the symphysis pubis and the anterior superior iliac spine. Compress it and release slowly. The pulse should gently tap against your fingertips. To locate the popliteal pulse, bend the patient's knee and feel for the pulse in the popliteal fossa. Next, palpate the posterior tibialis pulse in the groove between the medial malleolus and the Achilles tendon. Assess the dorsalis pedis pulse by palpating lightly lateral to the extensor tendon of the great toe. Check for edema by pressing over the tibia or medial malleolus for 5 seconds and then releasing the pressure. Normally, finger pressure does not leave an indentation or pit. If it does, grade the pitting on a scale from +1 for mild pitting to +4 for severe pitting. Continue to assess the legs by evaluating their sensory function. As you did when you tested the sensory function of the arms, assess the patient's legs for light touch sensation, pain sensation, temperature sensation, vibration sensation, and position sensation. Next, test the patient's motor function by assessing his deep tendon reflexes. First, test the quadriceps reflex. Have the patient sit up with his legs relaxed and dangling over the edge of the exam table. Place one hand above the knee. Then tap his patellar tendon with the reflex hammer. The lower leg should extend and the quadriceps should contract. Next, test the Achilles reflex. Have the patient bend his knee, rotate his hip outward, and dorsiflex his foot slightly. Then tap the Achilles tendon with the reflex hammer. The normal response is plantar flexion. Finally, test the plantar or Babinski reflex. To do this, stroke the lateral aspect of the sole of the foot from the heel upward. The normal response is plantar flexion with no toe fanning or great toe dorsiflexion. If any of the patient's reflexes are hyperactive, check for clonus, an abnormal pattern of rapidly alternating involuntary muscle contraction and relaxation. Lightly support the lower leg in one hand and dorsiflex the foot with the other hand. Normally, you should not see extra movements or contractions in the leg. During the next part of the assessment, you'll evaluate cerebellar function. For the heel to shin test, ask the patient to place one heel on the opposite knee and slide it down to the ankle. He should be able to do this in a straight line on the shin. To assess the patient's gait and gross motor function, instruct him to walk 10 to 15 feet, turn, and then walk back toward you. His movements should be smooth and coordinated. His arms should swing freely, and he should turn without losing his balance. Now perform the Romberg Test. Have the patient stand with his feet together, his arms at his sides, and his eyes closed. Standing close to him, observe him for 20 seconds. He may sway slightly, but should not lose his balance. This simple test assesses the acoustic nerve, position sense, cerebellar function, and muscle strength. To assess tandem walking, have the patient walk heel to toe in a straight line. He should be able to walk in a straight line without losing his balance. For a male patient, the complete head-to-toe assessment ends with a genitalia and rectal exam. Usually, a specialist does this detailed exam, especially if the patient has a specific genitourinary complaint. If you're doing a detailed assessment, adjust the patient's gown and drape and inspect the inguinal region for bulges. Palpate the inguinal lymph nodes, which should not be enlarged or tender. Then assess for hernias. Ask the patient to bear down as you inspect the inguinal and femoral areas. You should see no bulging. Palpate the inguinal canal for hernias. To do this, place your index finger along the upper scrotal sac and insert your fingertip into the external ring. Have the patient bear down while you gently push your finger through this ring. You should not feel bulges. If you are performing this part of the assessment, also plan to inspect and palpate the penis and scrotum. And while you're doing this, teach the patient how to perform the testicular self-exam. Inspect the perianal area and palpate the anus, rectum, and prostate gland. As with a male, a specialist usually performs the genital and rectal exam on a female patient. If you must perform this part of the assessment, be sure to inspect and palpate the external structures, use a speculum to examine the internal structures, collect all appropriate specimens, and perform a rectovaginal exam or rectal exam. With any patient, be sure to wipe off any excess lubricant after withdrawing your fingers. If you find stool on the glove, test it for occult blood. When you've completed the exam, have the patient dress, and then discuss your findings with him. Be sure to correlate his health history with your findings. To perform an effective head-to-toe assessment, you'll need comprehensive information as well as practice and sensitivity. Use this program to help you practice and refine your assessment skills. By combining the steps as we've shown you, you'll keep your patient as comfortable as possible while ensuring a complete assessment from head to toe.